Hello everyone. The topic for today is classification of removable partial denture, and we'll see in detail on the Kennedy's classification and Applegate's modification. The contents that we're going to see in this discussion is introduction, parts of a removable partial denture, need for a classification, requirements of an acceptable classification, the various classification of partially edentulous arches that are available, and see in detail on the most acceptable Kennedy's classification, Applegate's rules, and the modification of Kennedy's, their merits and demerits. Introduction. A removable partial denture is that which replaces some teeth in a partially edentulous arch. The removable partial denture can be readily inserted and removed from the mouth by a patient. This is the definition according to GPT-9. Parts of a removable partial denture include the major connector, minor connector, rest, direct retainers, indirect retainers, stabilizing component, artificial teeth, and the denture base. Need for classification. Ease of communication between the dentist and the laboratory personnel is required. It facilitates case history recording and immediate visualization of the edentulous arches. They formulate a good treatment plan, formulate basic design principles which might be applied to similar situations. They anticipate the difficulties commonly to occur in such particular designs. Coming to what are the requirements of an acceptable method of classification, it should permit immediate visualization of a type of partially edentulous arch that is being considered. It should permit immediate differentiation between the tooth-supported and the tooth and tissue-supported prosthesis. It should be universally acceptable. These are the various classifications given by a lot of authors and their corresponding years. Among them, the most acceptable ones are the Kennedy's classification and the Applegate's classification, which is a modification of Kennedy's, which we will be seeing in detail today. Coming to Kennedy's classification, it was proposed by Dr. Edward Kennedy of New York in 1925. It is based on the position of the edentulous spaces to the abutment teeth. It is composed of 4 basic classes. The numeric sequence is basically based on the frequency of the occurrence, which means class 1 occurs at a much higher frequency than the class 2, continued by class 3 and class 4. Kennedy's class 1. It is characterized by bilateral edentulous area located posterior to the remaining natural teeth as seen in the picture. Kennedy's class 2, it displays a unilateral edentulous area located posterior to the remaining natural teeth. Kennedy's class 3 presents a unilateral edentulous area with natural tooth both anterior and posterior to it. Class 4, it displays a single bilateral edentulous area located anterior to the remaining natural tooth. It is important to note that this edentulous space must cross the dental midline. Modification spaces, additional area of edentulism in the dental arch are considered as modification spaces by Kennedy. Coming to Applegate's rules, he gave these rules in 1954. These rules give us a guideline for doing the Kennedy's classification. Rule number 1 is this: classification should always follow rather than precede the extractions that might alter the original classification. Rule 2, if the third molar is missing and not to be replaced, it is not considered in the classification. Rule 3, if a third molar is present and to be used as an abutment, it is considered in the classification. Rule 4, if a second molar is missing and is not to be replaced, that is, if the opposing second molar is also missing and not to be replaced, it is not considered in the classification. Rule 5, the most posterior edentulous area always determines the classification. Rule 6, edentulous areas other than those determining the classifications are referred to as modifications, and they are designated by numbers rather than the spaces. Rule 7, the extent of modification is not considered. Only the number of additional edentulous area is considered. Rule 8, there can be no modification area to class 4 arches. Any edentulous area lying posterior to a single bilateral area anteriorly will determine the classification. What are the merits of this system? The classification is simple and universally acceptable, allows to clearly communicate and diagnose the condition of the oral cavity in which the missing teeth are to be replaced. It permits visualization of the type of partially edentulous arch. It provides the type of support that is required, and the number and the location of the edentulous spaces can be identified. It also provides the design for each class. What are the demerits? It does not assist the choice, number, location, or the condition of the abutment tooth. It does not assess the hard and soft tissue status. It does not indicate the position of the individual tooth and also does not permit assessment of occlusion. Applegate in the year 1960 attempted to expand this Kennedy's classification. He gave two more groups, class 5 and 6, where he assessed the condition of the abutments. Kennedy's modification by Applegate of class 5. This is an edentulous area bounded anteriorly and posteriorly by natural tooth, but in which the anterior abutment is not suitable for support. In this current picture, the anterior abutment is a lateral incisor which is not suitable for support. Class 6 is where an edentulous space in which the teeth adjacent to the space are capable of total support to the required prosthesis. Identify the classification of RPD. It is a Kennedy's class 2. Here, the classification of RPD is Kennedy's class 1 with mod 2. There are two additional edentulous spaces. Thank you.